Hi, this is Dr. Tom Rafai, and welcome to Noted, News of the Day, brought to you by the True Health Initiative. I'm a board certified lifestyle medicine specialist, and we love to bring you really top level thinkers in the areas that the True Health Initiative is truly interested in. And one of those, of course, as you can imagine, is effective ways to mitigate stress or manage stress. We have Professor Justin Feinstein with us today, who is an expert in the research area of floating and will give us some great information in terms of research and clinical, but maybe a lot of practical. And if you don't mind, Professor, I'm going to just start off with my experience with floating because I came across it in an interesting way and I really needed it. And it has been very helpful to me. And I don't know squat about it compared to you, but I'm planning to learn more about why it feels so great. But I have admittedly always had trouble with meditation and yoga. And a gentleman, David Carroll on LinkedIn, suggested to me floating. I didn't exactly know what he was talking about, but I did my own research. I found a place in the area here in Metro Detroit, and I went and I learned enough about it to get in a flotation tank and actually do it. I won't kid you. Maybe we could discuss a bit about a minor claustrophobia moment that I had. I have mild to moderate claustrophobia, but I managed it pretty well. I just found that by opening the door of the tank just for a bit and seeing some light, I grooved really well. And all I can say is that I almost felt like my mind was released. And the way it was relaxed was I had business ideas, everything. It was just by getting rid of all stimuli otherwise, from hearing to sight, to the body weight, my mind just felt free and unburdened, and yet at the same time rested and relaxed. I felt like it was in that movie Limitless. I don't know where the guy takes the pill and he can think effortlessly. So there's my little story on floating, and I've been back again, and I plan to keep going back. Frankly, it really has helped me mentally, but I didn't realize I also felt physically just completely relaxed, and maybe you'll have some information there. But if we can just start with a little bit about your background, where you do your research at, and what got you interested in the core of your soul in this area of research, Professor.
Sure. So I'm a clinical neuropsychologist by training. You can see in the background my alma mater, University of Iowa, where I did a lot of my neuropsychological research. And I've always been fascinated about how the brain produces very primal emotions like fear and anxiety. Anxiety is really the area that I study the most. And it's a ubiquitous condition. As you alluded to, it's one of the main initiatives of True Health is to find better ways to mitigate stress. And stress is oftentimes one of the most prominent symptoms of anxiety disorders. And I think, unfortunately, we're living in a day of age where our nervous system is just being bombarded with stimulation. It's a natural consequence of modern times, modern technology, the 24/7 connectivity. And our nervous system is woefully unprepared for this level of stimulation. We are the guinea pig generation. I oftentimes tell that to my own children. But we've never really experienced a world, a lifestyle where our nervous systems are under this amount of stimulation. And this information technological era has in many ways exacerbated the stress and anxiety that we're currently living in. And then you add to that what we've all been going through the past year with the pandemic. And right now, I could say base rates of stress and anxiety are off the charts. And the average person is really struggling to find ways to control this. And so when I got interested in floating and this technology that we refer to as flotation rest standing for reduced environmental stimulation therapy, it was really under the context of what's happening at this level of society and the need for new treatments, new therapies that could help the nervous system cope with this inundation of stimulation. And so about, 8 or so years ago, I moved from my postdoc at Caltech to an up-and-coming nonprofit neuroscience research institute called the Laureate Institute for Brain Research. And we created the world's first laboratory really focused on studying floating in both the body and the brain, and how it could potentially benefit those who suffer from stress and anxiety, which really had never been explored before in patient populations. And so we started this research, and over the past 7 years or so, we've published a number of papers on this. We have a number of other papers in the pipeline. But the fascinating thing about sort of doing this type of research is you're really trying to understand what happens when you remove all of this stimulation from the outside world. You know, this is sort of a different way of going about it. A lot of times in the fields of anxiety and stress research, you look at what happens when you become anxious or stressed, and you look at the ramifications on the nervous system. But really, the model that we're working with in this unique technology of floating, which we should get into, is about the opposite of that. What happens to the brain, to the body, to the nervous system when you take away all of that outside stimulation? And so it was really been a fun time for me to do this research right in the midst of all of this connectivity that we're all struggling through.
Absolutely. And I think, as you mentioned it, maybe we could paint a little bit more of a picture than the rudimentary one that I did, and maybe others might be thinking, as we mentioned before we hit record, did they mean like floating in the Dead Sea? Where was this, by the way, first initially thought of as a potential therapeutic model? And feel free to answer that in the context. But let's just talk a bit about what someone would experience floating, maybe in a clinical, but then also commercial context, because I think most of the people that are watching they may get involved in the study. You may give us information about how you can be part of clinical research in floating. Please, by all means, let's do that. And then I'm sure many will also be so interested they're just going to call their local, they didn't know was there, commercial floating business and float. So give us an idea of when you say floating, what does that mean? Paint a picture for us.
Yeah, sure. So this is a lot different than floating in typical environments. Basically, we've created this highly specialized environment that systematically removes all forms of external stimulation. So the pool that we created at the Laureate Institute for Brain Research is a wide open 8-foot circular pool. So you could stretch out fully, do the Da Vinci Vitruvian Man if you want. It's very spacious. The pool itself only has about a foot of water. But in that foot of water, we saturate it with about 2,000 pounds of Epsom salt. So now you've turned that foot of water essentially into a mattress of water. You don't have to move a single muscle to stay afloat. So even people who can't swim could lie in this salty water mixture and just float effortlessly. And that's a key part of this. So we've removed all the weight of the world, the gravity of the world, if you will, on the body by creating this highly saturated mixture of water and Epsom salt. The next thing we do, though, is we try to match the temperature of the water and the temperature of the air to your skin temperature. We try to remove the need to thermoregulate. So the water and the air is all about 94, 95 degrees or so. It's a little bit cooler than core. And by doing that, you lose track with where the external body sort of begins and ends. It sort of immerses with the environment around it. And this is a key part of floating as well, is getting the temperature just perfect. And then now you add to that a room built around the pool, a spacious room that is soundproof, that's lightproof, and obviously temperature and humidity controlled. And so by doing this, you're creating an environment within the pool itself that minimizes all stimulation on the human nervous system, whether that's visual stimulation, auditory stimulation, proprioceptive or tactile stimulation from the environment, smell and taste and so forth. And so what I like to think of when I tell people about floating is you've created an environment that almost reflexively induces homeostasis. It tries to allow the nervous system to exist in an environment where it's not being perturbed and disturbed in any way, shape, or form. And it allows the nervous system then to relax, go into a state of quiescence. And I think this is a really important part of floating, the homeostatic inducing properties of floating that are very powerful, partially creating what you felt after your own float. And I think this is something that is very difficult to obtain in other environments. You know, the water is denser than the Dead Sea. It's different than floating in the ocean where you have all this sound and light stimulation and water movement. It's a very serene, relaxed environment, but it's perfectly calibrated to minimize stimulation of the human nervous system.
So which ultimately when you get there, all of this, as far as my experience is concerned, is very true. A couple of the caveats I guess I'll ask you about, people probably already guess, are care not to get it in your eyes if you can avoid that, right? And then I suppose to some degree a practical issue of not necessarily shaving just before you go, particularly in sensitive areas. Although one little part on my finger, by about 10 minutes, I didn't feel it anymore. I guess that it wasn't an issue. Some of those other issues I may have, in particular the claustrophobia and how that might be managed in a more commercial, not necessarily as wide, because I think the flotation area and research you're talking about really addresses that. It's not as close of an environment as a commercial float business, correct?
That's right. You know, we've sort of created this open model of floating where you don't need any enclosures. You sort of build the room around the pool to calibrate all these variables. Now, the typical float tanks you might see in recreational facilities and that are popping up really all over the world now tend to be smaller and more enclosed and could be claustrophobic for some. I think what people need to recognize is regardless of where they float, they are in complete control the whole time. They could get in and out of the float tank whenever they want. They could have the door open or closed. Most float centers have lights in their float tank, so you could have the light on or off. It's your choice. Many float centers have speakers built around the pool, so you could be listening to music or guided meditations and so forth while you're floating. So it doesn't have to be this completely immersive experience where it's just you alone in there. You could go into this gradually, take your time, and not feel like you have to jump in right away with that first float session.
Right, and they were actually kind enough where I went to leave on the lights for 15 minutes and then turn them off. So yeah, it even doesn't have to be on or off. It can be, I'm sure most places would help you with that as well. And you're right. I knew I could immediately get up, and I did. The first time I just opened the door, the light was on for a bit, went back, and it just went away. And I do have issues with claustrophobia, but I was so relaxed. And that was only the first time. The second time I went, I didn't have any issues. So if anyone fears, don't fear. Everything Professor Feinstein is saying is true as far as my experience.
That's right. And there is an acclimation process that you bring up. The first float's very novel. You're used to this. It takes a little while to get used to this environment, I should say. It's not something that just clicks right away. To get into this sort of zero gravity state, being comfortable in the environment probably takes a float or two. What we're finding in our research is it takes most people about 3 floats to fully acclimate, where they're completely comfortable, where their nervous system is ready to enter into those relaxed states. And usually after about 3 or 4 floats, people have gotten a good taste of the experience. But certainly with that first float, I think there's a lot of acclimation. So people should recognize when they go into this, there is a learning experience, a learning process that takes several floats to unfold.
Now I use the donut for the back of my head to let my head float. I think in a more, was I cheating, or is that?
Oh, no, that's fair. Those help, It's amazing. A lot of people don't realize how much stress we carry and harbor in our body, especially in the neck in the muscles around the spinal cord and the back. And when you're in this zero gravity like state, suddenly that muscle tension comes to surface. So it takes a little while to get comfortable, to work it all out. And sometimes you do need props like a little pillow or something in the back of your head just to get used to it.
And I was taking advantage in the beginning of just kind of stretching out, but I eventually just got to absolute relaxed floating. So I think, as you're saying, there aren't really rules to this, so don't feel that you have to abide by anything other than don't start splashing around.
That's right. Don't get water in your eyes or mouth. It's very salty.
Yeah.
we recommend avoiding that.
It's actually pretty easy to just sit back slowly, and you really do float. So you're not really going to splash unless you aggressively try to do that. So that's the only thing to avoid. So some questions in regards to expectations in terms of, let's talk about the stress management in terms of the anxiety and stress and so forth. What is the cadence? How often, if someone's going to try to recapitulate what's in research, how often would they need to go to get that effect? Or maybe it's a certain amount of an effect that happens for this long after you've had it, and that's it. But is there a cadence, and is that also complemented by a certain amount of time? I mean, where I went, it's an hour. Is that the right amount of time, or is that a commercial choice?
I think everyone needs to go at their own pace. Most float centers will offer about an hour. I've seen some go up to about an hour and a half. That's pretty much the average range of a float session. But if you want to get out early, people should feel comfortable doing that. They shouldn't feel like they need to stay there for the whole hour. What I could say in our own research is most of the floats we studied were anywhere from 60 to 90 minutes. And we're finding most of the physiological changes that happen during a float, for example, with blood pressure reductions, are occurring within the first 10 to 15 minutes of the float session. So you're getting the effects right away. In terms of the stress reduction, the anxiety reduction, in the patients we worked with, we're seeing that happen right away within that first hour of floating. So a 1 hour session, if you bring stress or anxiety into it, by the end of that session should relieve a certain amount of that stress and anxiety. And then what we've done is experience sampling. We'll follow people up systematically over the course of hours and days post-float. And we're finding that the stress relieving and anxiety reducing effects tend to last about a day or so. So 24 hours or longer post-float, which is great. Typically a lot of the anti-anxiety pills people take for short-term anxiety reduction have a half-life of anywhere from 4 to 8 hours. So the fact that we're seeing anxiety reduction persevering into the next day, I think is a promising indication that there is some benefits that persevere much longer than the float itself. This is something that we're actively trying to study now and understand, but it seems to be a residue that lasts for about a day. And now in our NIH-funded clinical trial, where we're looking at sort of the long-term effects of multiple floats, we're allowing people to sort of set the time course in between sessions. So in one condition, people are randomized to float weekly, so once a week for an hour. In another condition, people are allowed to set their own preference. So they could float every day if they want. They could float a couple times a week, all the way up to maybe 2 or 3 times a month. And so we're looking at the variation in time in between sessions right now. I don't have a clear answer to give you, but I think a lot of people who suffer from pretty severe stress and anxiety know when it's bubbling back to the surface. So if they go into float, they feel some relief. Maybe a couple days later, they might notice this bubbling back to the surface, at which point they may want to float again. So, I would say if somebody is really in the throes of stress and anxiety and they're finding floating is benefiting them, they should feel comfortable doing this, at least several times a week if they're noticing the benefits.
Makes me wonder, what is the cost of a flotation unit, and starting to think about investing for one in the house. Some of the specific effects you mentioned, for instance, blood pressure. A couple of questions in terms of how long that lasts. I mean, this is that's a serious killer, right? Blood hypertension is, arguably the biggest metabolic killer. We give a lot to obesity, but the truth is that, if you're lean and you have high blood pressure, you're not in great shape either. That being said, what is the length of that? And people will ask, I know they're already thinking, is the magnesium getting absorbed through the skin and having a blood pressure and overall relaxing effect?
Yeah, so we could start real quickly with that latter part. So we've studied this. Epsom salt is comprised of magnesium and sulfate. And obviously, if you have 2,000 pounds of it surrounding you, it's an obvious question. Is it being transdermally absorbed? We don't have good evidence for that yet. Now, part of the problem is measuring magnesium mostly occurs through blood and urine. And that's only giving you a small preview of body magnesium levels. Almost 95% or more of body magnesium is stored within the bone and tissue of the body. So blood and urine is only giving you a very small snapshot of that. But when we looked at magnesium levels pre and post float, we did not see evidence of transdermal absorption. It doesn't mean it's not happening at some other layer, perhaps in the interstitial tissues. We haven't looked at that yet. It's hard to measure those things. It's possible that magnesium is playing a role. We just haven't seen it in our research. Now, what we have seen, and really the largest physiological effect we've seen, and we've looked at a number of different metrics, is blood pressure reduction. And it's instantaneous. It's happening in every person we've studied. Even people who don't necessarily have the greatest of floats still show a blood pressure reduction. And it's mostly in the diastolic region of blood pressure changes, which tend to be pretty tenacious in terms of moving for other. We're on average during a float session seeing a 10 to 15 point drop in diastolic blood pressure. Systolic is about anywhere from 4 to 5 point drop. So it's a bit smaller in the systolic domain. But diastolic blood pressure is reflexively dropping. We're seeing it in anxious people. We're seeing it in healthy people. It doesn't matter what the patient population is that we're looking at. And I think it may have something to do with the float environment, the warm water, taking pressure off of a lot of the musculature in the body. And, let's not forget our entire cardiovascular system is coated in smooth muscles. And so we may be relieving some of the tension within those smooth muscles just by being in this very unique environment. But we haven't actually isolated how is blood pressure so reflexively being reduced in this environment. I think it's a fascinating area of study. Most of our work has only looked at blood pressure changes during the float itself. So I can't really speak to how long these changes last for. I think it's a low-hanging fruit. A colleague of mine, Tom Fine, who was at University of Toledo College of Medicine, did a study many years ago in a small group of patients with essential hypertension, where he let them float many times over a 4-month period. And then he looked at their blood pressure 4 months later. And he actually showed this perseverance of blood pressure reduction in this small group of patients. This obviously needs to be replicated, but as you alluded to, this is a major issue. Hypertension is a major issue. They just changed the definition of stage 1 hypertension to 130/80, which means millions of mostly healthy people without any major issues are now going to have a hypertension diagnosis. And if you could reduce blood pressure on the order of 5, 10, or 15 points even, you're going to take someone from a hypertensive stage 1 into a normotensive range. So I think this is a valuable part of floating. It definitely seems to reduce blood pressure in a meaningful way, but we just don't know yet how long these changes are lasting for.
And there's at least 108 million people with hypertension. And the numbers you're mentioning, if they were sustained, I have to go back and calculate, but there are at least a 30, and I think we're talking about 50% stroke risk reduction, if that was sustained, particularly in somebody that's hypertensive. So this is serious stuff. I don't know if it's due to reduced cardiac output or systemic vascular resistance, one or the other, a combination of both, but the bottom line is it's happening. We look forward to the next noted with you and explaining the mechanisms, but clearly we know that it is happening. Why, we can figure out, but that is a great benefit as far as I'm concerned. And I can just say again, when I come out of floating, there is this, this is soft, right? It's not science, but there's a feeling of serenity that is subjective. But look, that's ultimately that's the final determiner is how does somebody feel. I mean, it's great that it's phenomenal that someone's blood pressure is better. And I certainly wouldn't want to be serene with higher blood pressure, but it's good to know that I'm feeling serene and my blood pressure is actually even lower and better. So I think, yeah.
It's really interesting you bring that up. So we tap into this variable. In addition to measuring sort of physiological changes, we're always asking people experientially how they feel. And as you mentioned, serenity is one of the biggest changes outside of just reducing anxiety and stress. We see this pronounced increase in serenity, self-reported serenity. And the degree to which that increases is correlated with the degree to which blood pressure reduces. We haven't published that. That's a forthcoming paper that we're writing up now. But to me, that's fascinating because it does link the body with the mind there. And it seems to be the case that when you enter into this relaxed physiological state of body, the mind shortly follows thereafter. And this serenity is very powerful because not only does it help people who are suffering acutely from anxiety, but as you mentioned, it opens up the mind to a lot of possibilities and you're able to think more clearly. You're able to problem solve, make decisions, think creatively. And this is a big part of the float environment. I like to think of it almost like a tabula rasa for the nervous system. And it creates that blank slate that then allows you to connect points from A to B in a much clearer way without all the distractions of the world and your own thought processes. And I think that's an important area that a lot of us are missing. We don't ever get a moment to ourselves in this modern world of social media and all this connectivity. We're always kind of inundated with stimulation. To just sit alone with your own thoughts for just an hour, allow yourself to process through that. That could be very powerful for a lot of people.
Oh, I thought of some of my best business ideas in that. I mean, it was as if a weight was taken off my mind, and your mind is not, put to sleep. No, you're. Well, I mean, I guess I could. I haven't yet fallen asleep. I might, but that would be for a good reason. But my mind was freed. It was connecting the dots. That was a great way of putting it because I was putting together the dots of things that I couldn't do because my mental bandwidth was taken away by some distraction outside of that flotation chamber. I would say that CEOs out there, and this is a spontaneous thought, you should consider floating. Your creativity will probably go up substantially, and try. You're certainly not going to have any harm by it. So you'll really give it a try. Other features, if you don't mind, of restorative nature. Mentally, we've talked a lot about it. We've talked metabolically in terms of blood pressure, but in terms of arthritis or just, body aches and pains, athletic recovery, or just really life recovery, I would say, what is some of the research we have in that area in floating?
Yeah, it's a very powerful way to reduce muscle tension. And muscle tension is ubiquitous in a lot of different pain-related conditions, not just stress and anxiety. And there's actually been quite a bit of published data, including from a group in Sweden that's looked at this, is you take people who have burnout, stress-related pain in their body, and you float them. It's a fantastic way to overcome a lot of those symptoms. Pain relief is immediate. People who float with fibromyalgia, arthritis, especially rheumatoid type arthritis, have reported these sorts of benefits where they'll feel a lot of pain going into the float, and then during the float itself, the pain literally evaporates from their consciousness. And once again, I think it suggests to me a lot of pain is being proprioceptively driven through the spinal cord. And when you could take off that pressure and reduce that stimulation, suddenly the pain is mitigated. There's been researchers in Australia and New Zealand who studied athletes who are in a lot of pain after an intense workout or performance. And they find right away this is a great tool for recovering from an intense workout. As a consequence, you're actually seeing a lot of professional athletes using floating as part of their regimen. Steph Curry, Tom Brady.
Oh, yes, of course, Tom.
Since Wimbledon was just this past weekend, Djokovic, these are regular floaters. Tom Brady actually owns a float tank in his home. And so these are people who are doing this on a regular basis, partially for recovery post-workout or after a competition. But there's another aspect that people like Steph Curry are talking about, and we've seen in our own patients, and maybe we should talk about this, which is they're also finding that floating helps them focus under moments of stress. And I think this is an important ingredient that a lot of people miss when they think of floating. You know, a lot of people refer to floating as a form of sensory deprivation. But in fact, what our research is showing is just the opposite. It's a form of sensory enhancement, but for the internal senses of the body. So when you're floating, you feel your heartbeat. When you're floating, you feel your breath. You feel respiration happening, each breath in and out, moment by moment. And so in essence, this environment of internal sensory enhancement allows people to enter into a meditative state, unlike any other environment we've ever seen. And that to me is a part of floating that is often getting missed when people just talk about sensory deprivation. I think that's a misnomer. I don't like to use that word because it scares a lot of people. But this sensory enhancement aspect of floating, where you could feel your heartbeat, where you could feel your breath quite viscerally, moment by moment, allows it to teach you how to enter into these mindful, present moment awareness states. And that could be very important for athletes. It could be very important for people who suffer from stress and anxiety, because typically in those moments of stress and anxiety, when you're Steph Curry and you're going up for a three-pointer and adrenaline is rushing through your body, your heart's palpitating, and 99% of ordinary humans would totally screw up that shot, he's able to sit there in total calm and make that shot without any issues whatsoever. And so to me, that aspect of floating where you're able to handle the surges of adrenaline better is perhaps why athletes are using it. Now, my patients with anxiety who are struggling immensely with feelings of their heartbeat, feelings of their breath. You know, you take the typical patient with, say, panic disorder, they feel their heart fluttering or they feel their breath constrict. They think they're dying. They think they're having a panic attack. They'll rush to an emergency room to try to help themselves. They're now in a float environment where they're immersed with the feeling of their breath and heartbeat. But it's juxtaposed on this complete state of physiological relaxation where your blood pressure is at an all-time low, where your muscle tension is reduced to an absolute minimum, and you're completely relaxed in body and mind. And so suddenly these aversive sensations of perhaps the heartbeat and the breath become less aversive. They become associated with this relaxed physiological state. So the next time this anxious person finds themselves feeling this surge of adrenaline in the real world, or Steph Curry finds himself feeling this surge of adrenaline when he's at a three-point line with 3 seconds left, they could handle it better. They could cope with it better because they have this new association of their own internal sensations with a state of relaxation. And to me, this is a powerful part of what floating could offer to people, is sort of a bridge towards meditative states that are very hard to achieve in day-to-day life. And then once you cross that bridge, once you experience that, you could bring those skills to bear when you enter the real world again.
Yeah, and I think that there's, the ability to almost expand. I don't want to put it this way because maybe this is not correct, but in a sense, when people say the term willpower, I mean, it's really, in a sense, the level of your ability to manage stress. And this kind of seems to give you a more, a better baseline. You're not waking up with 25% of your stress already used up when you wake up. You're really starting from a fresh basis. And I wonder, just as something you don't necessarily know about me, but I have binge eating disorder, and my youngest brother passed of binge eating disorder, and impulsive eating runs in the family. And the idea that someone who's dealing with disinhibited eating because of the ability to manage stress better, I wonder if there is, and maybe you're already thinking about this, the potential to study people with disinhibition or impulsive eating and give them this environment and see, not purposely stress them with a pile of brownies or anything, but in the real world, could it accentuate a metabolic health or weight management program? It's just a thought that came to mind when you mentioned that. As you can imagine, if there's a blood pressure effect, there may be other metabolic health effects, even in terms of psychology and the psychology of eating that allows us to handle a really, speaking of high stimulation, a very, very I hasten not to use the word toxic. I don't like to say good or bad food, but let's just face there's a lot of high risk food around us that we can't always live in our house and have this perfectly controlled environment that this might also apply to. I don't know. I can just tell you from my end, now that I think about it, which is probably obviously not it's an N of one, it's not a study. But if anything, it's helped me get rid of some of my COVID weight. I even put on 7. I didn't have COVID-19 or a quarantine 15. I hit right in the middle at 17. And so I'm down about 14 of those. And I don't know if I can attribute how much I can attribute to my recent floating, but it certainly has not hurt. So it's a thought. The specific, I guess, area, we kind of went there, but in terms of arthritis and people are having trouble with weight bearing type, you almost went there, I think, or maybe you did and I missed it, but specifically, has floating been studied in that context of more severe arthritis and the benefits we know about, pool therapy, but this is a step even further. Has there been research in that area?
Not a lot, and not a lot in binge eating disorder either. We've done some work, and my colleague at Laureate Institute, Dr. Saib Khalsa, has really been the leader in this on other types of eating disorders like anorexia nervosa. We've worked with both outpatients and inpatients with anorexia and floating, and shown quite a bit of benefit, and especially in terms of anxiety reduction and some shift in body image, which is ancillarily related to this idea of binge eating, right? Patients post-float with anorexia tend to come out of the float with a more realistic body image. Oftentimes they're very skinny and they feel very fat, but they come out of the float feeling more like their real body. And, I wonder if part of a perhaps parsimonious explanation for a lot of this is that when you're in a float environment, it puts you in touch with this brain-body connection in a very visceral way, as we've sort of alluded to. And it allows you to understand the internal needs of your body better. And so when you have conditions like binge eating, or the opposite, like with restriction, with anorexia, eating restriction, you're not necessarily getting the right signals from the internal body, right? The nervous system is not knowing when it has enough nutrients or has too many nutrients, right? And it tends to compensate in these aberrant ways. And perhaps what floating might be doing is giving you a keener sense of your own internal body's needs, moment by moment, and allowing you to regulate accordingly. And so, I think it's a great idea. It would be a low-hanging fruit to do a study like that, where you take someone with binge eating and you have them float or do some control condition and then expose them to a high-calorie diet afterwards and see if you have better regulatory control over it. I think that would be a fascinating experiment.
Yeah, I would suggest something maybe along the lines of having a group both start an intensive lifestyle intervention with all the standard top features, one with and one without floating. Please don't. I don't know how much floating can help me not want Starbucks brownies. I know they put some type of addictive property in there. So with that being said, what are the odds, as we're coming to close in time here, of of this being looked at as a therapy worthy of reimbursement, worthy of literally a physician or nurse practitioner or physician assistant, or whatever the case may be, prescribing this in some way, or in psychology, in some way, shape, or form, therapeutically, and where it's most, got the deepest evidence. Is there any hopes of that?
It's a personal goal of mine. I've seen through my own research with patients who are suffering from rather severe and treatment-resistant stress and anxiety that this could benefit them quite readily without very many side effects at all. It's a very safe treatment, and we've seen time and time again these large effect sizes in terms of stress and anxiety reduction in all of these patient populations. And so to me, it seems like a very natural next step to get to the point where this can be reimbursed by treatment providers. I think what we need to do is grow the evidence base. Right now, anyone could go to www.clinicalfloat.com. And on clinicalfloat.com, there's a repository of all the peer-reviewed papers that have been published on floating in various populations, including work from my laboratory. And the evidence base is there, but it needs to be larger. I think we need larger scale randomized controlled trials, some of which we're already doing under some NIH funded studies. And we need to show that this is much more than, quote unquote, a placebo effect. And I would say that as that research bears out, as we could get a better grasp on the various conditions, like one of the conditions you mentioned is arthritis. There's been very little research other than a few case studies with rheumatoid arthritis. So we need more research in that domain. I think there's a lot of other low-hanging fruits in terms of other domains that could be studied with floating, whether that be people with insomnia, or for example, traumatic brain injury or post-concussion syndrome. These are all low-hanging fruits where this environment of reduced stimulation of the nervous system could be beneficial. And really very little research. So I would say right now, the three areas that probably have the most support in terms of evidence base is very immediate reductions in pain, stress, and anxiety. Those are probably the three big ones with the most empirical support. And so people who go into their float session with high levels of pain, stress, or anxiety should notice right away during the float itself and during that residue afterwards, these reductions in pain, stress, and anxiety. And to me, if that could be done in a reliable manner that doesn't require drugs, especially these highly addictive drugs, whether it's benzodiazepines or opioids, why shouldn't this be recommended and referred by physicians and other treatment providers? To me, this seems like a very natural alternative to these short-acting, highly addictive drugs. And if you could reliably reduce pain, stress, and anxiety in this manner using a naturalistic intervention like floating, that seems to me to be the next step. And that's part of why I've created this Float Research Collective. It's going to be a 501c3 nonprofit, but the website is floatresearchcollective.org. And the main goal is to raise money to conduct the sort of research that's necessary in order to get this reimbursed by health insurance providers and prescribed by medical professionals.
So floatresearchcollective.org is a site in which to help build the necessary funding to study clinical floating. What about, is there a website that someone could look to see whether there's a study locally they could sign up for? I think we talked about clinicalfloat.com, where there's the bank of what's been done. And then we talked about floatresearchcollective.org, where maybe there's, I might go and donate some money after this to help with the cause. But where is the cause happening? Is there a website that people can look and see where a clinical a float study is being performed and be a potential subject?
Currently not, unfortunately. the Float Research Collective will make that part and parcel of the organization once we
Okay.
obtain our 501c3 status, which we're hoping to do this year. I'm in the process of getting that going. And so,
Well, stay
right
tuned
now,
there.
unfortunately, there's not a lot of clinical research outside of the Laureate Institute in Tulsa, Oklahoma. And, one of my goals is, we were really the first people to study this in clinical populations. And personally, I would like to see dozens of other researchers come on board and study this very remarkable technology that's non-invasive, very naturalistic, and tends to have these very immediate clinical benefits. And so I'm trying to foster more float research, if anything. I think that's going to help advance the science, and then more importantly, get this translation into the real world where maybe this could be reimbursed. And I think that's going to be paramount.
Well, I mean, we couldn't be more supportive of in every aspect, from the far more natural way that this intervenes on so many aspects, potentially even, as you're saying, emerging evidence on metabolic health and blood pressure, but certainly stress, anxiety, and pain. And the research really needs to be supported. So again, floatresearchcollective.org, and obviously shooting for the nonprofit 501c3, fantastic. We think that is absolutely stellar. Is, I guess, one last question I can't help but ask, but in terms of post-traumatic stress disorder in the military, could this potentially have a role in that regard?
This is near and dear to my heart because I worked for many years at the VA hospital in San Diego with veterans who have PTSD. And I did a number of different therapies with them, including prolonged exposure therapy. These are young, mostly men, definitely some women as well, but they're, in their early years of life, 18, 19, 20s, and they just feel so hopeless. And every time they would come into the VA hospital, by the time they got there, they were really at the lowest of lows. They'd had their significant others, their friends, their family tell them, you need to go get help. And inevitably, they would get to the VA and we would diagnose them with PTSD, which they kind of already knew they had by that point. And they already had a number of other issues, oftentimes with addiction and so forth. And then they would say, all right, what could I do to get help? And we would have to tell them there's about a 4-month wait list for therapy. And they're in dire straits there. Right then, at that moment is when they need benefit, when they need something to take off some of the edge, some of the stress. And I would have loved more than anything to be able to turn to them and say, hey, there's a float tank. Why don't you go in there for an hour and then we'll talk afterwards? And just give them some immediate relief. To me, there's no reason why a float tank couldn't be at every VA hospital in the country. And it would offer this very immediate relief, especially for people with PTSD. We studied a lot of folks with PTSD in our research, and we found tremendous benefit. And we're not necessarily saying floating is going to cure anything. What we're trying to say is it provides this immediate relief where it helps the nervous system enter into a state of homeostasis. And that's what people with PTSD need. They're in this sort of state of dishomeostasis, if you will, perpetual stress. And they really need that immediate relief. And so, to me, I would love to make part of what the Float Research Collective does, a focus on disseminating this to veterans with PTSD and to the VA healthcare system.
I think even some of the more concierge type medical practices might want to consider getting a flotation unit for their own offices and offer it prior to while you're waiting. Here, let's give you some therapy. And I also wonder, I know you mentioned before, and then it could really help facilitate a therapy session if they came in relaxed. And I also just wonder, possibly even afterwards, because sometimes bringing up, or some of the psychologists we've worked with talk about, pulling off the scab. The therapy doesn't immediately relieve. It's a number of sessions, so that possibly even afterwards, and how that would be studied, I don't know. But we will make available I won't mention it here because it's a little bit harder, but I guess it's flotationlocations.com. And let me be clear, we don't have any THI has no relationship with any particular commercial place to float. And this isn't an endorsement of every single place that would be found at flotationlocations.com /where-to-float. But it's a place, to start, and you'll have to do your own research and buyer beware, caveat and all, but I think it deserves to at least be told so people have some resource to consider trying this on their own. Because all I can say is how this started for me and what led me to Professor Feinstein was me taking a chance and going and finding a place nearby. And it was an amazing experience. This was an amazing experience. Thank you so much, Professor Justin Feinstein. I hope we can get you to commit some months down the line as the Float Research Collective starts to advance and feed back to us. We would love to continue to help in that regard. We think it's a very big part of one of our pillars in terms of essentially wise ways to mitigate stress and certainly anxiety and pain. And this was a wonderful experience. Thank you so much for your time and coming on News of the Day, or Noted, here on behalf of the True Health Initiative.
Oh, thank you so much. Looking forward to coming back.
Thank you.